Good morning, Mom. My name is Ana Flortuno from BSN2. Today, I will be discuss the importance of each procedure, the indications and possible complications of the newborn care, Leopold's maneuver, prenatal care, and urinary catheterizations, male and female. So now, I will be discuss first the newborn care. So the importance of the newborn care. All newborn requires essential newborn care to minimize the risks of illness and maximize their growth and development. The warm, normal breathing, mother's milk, and preventions of infections are the basic needs of normal baby at the birth. So the indications of the newborn baby. Newborn care consists of evaluations for the needs of resuscitations, complete physical examination, administrations of prophylactic medications and vaccine, adequate feeding, safe sleep, proper hygiene of the newborn, and other important areas for baby well-being. Next is the newborn complications. So we have here the birth defect. The birth defect is health problem of normal physical changes that is present when a baby is born. So other causes problems is in more than one body system or organ. The birth defects may cause lifelong disability and illnesses. So second, the birth injury. Sometimes during the birth process, the baby may suffer a physical injury that is simply the result of them being newborn. So this sometimes called birth trauma or birth injury. So the causes of the newborn complications is a difficult birth or injury to the baby can occur because of the baby size or the positions of the baby. The third, the breathing problems. Apnea of prematurity is a term that means breathing has stopped for more than 20 seconds. It can happen in full-term babies, but it is more premature the baby, the greater than chances that apnea will occur. The fourth one is drug addiction. Neonatal abstinence syndrome is what happens after babies are exposed to drugs in the uterus before birth. So babies can then go through the drug withdrawal after birth. So the last one, the jaundice, hyperbilinemia in a newborn, happens when there is too much bilirubin in your baby. And now the second one, the Leopold's maneuver, are important because they help determine the positions and lie of the fetus, which in conjunctions with correct assessment of shape of the maternal pelvis can indicate whether the delivery is going to be complicated or whether sections is necessary. The Leopold's maneuver are important because they are help determine the positions and lie of the fetus, which is conjunctions with the correct assessment or shape of the maternal pelvis can indicate whether the delivery is going to be complicated or whether caesarean section is necessary. So the indications of the fetals will feel firm and smooth. The extremity, arm, legs, etc. The indications of the fetal will feel the firm and smooth, while the fetal extremity, arms, legs, and etc. You should feel like small irregularities and protrusions. So the fetal box, once determined, you should connect with the form found in the upper abdomen and also a mass in the maternal inlet, lower abdomen. So, no complications for the Leopold's maneuver. A skilled nurse should execute the procedure and and care should be taken not to disturb the fetus in excessive manners. And the third one is the prenatal care. The prenatal care importance, the proper prenatal care allows for inspections of the skin. It keeps the prenatal care clean and less likely to break down. It also decreases the risk for urinary tract infections. And the indications for prenatal care, it's involved washing the genital and rectal areas of the body. It should be done at least one day during bed bath, shower, or tub bath. It is done more often when a patient is innocent. This prevents infections, odor, and irritations. The complications of prenatal care is a common postpartum prenatal issues. It includes pain control, proper hygiene, preventions of constipations, and resumptions of sexual activities. So the last one is the urinary catheterizations, female and male. So urinary catheterizations reduce the risk of infections and kidneys damage by making that your bladder is emptied either continuously or at irregular intervals. So it is also to accurately measure urine output in critical ill people. So to drain the bladder before or during or after a person has a surgery. During childbirth, to drain the woman's bladder after the epidural anesthetic is to deliver the medications directly into a person's bladder. For women that facilitate directly drainage of urinal bladders, for female complications, acute urinary retentions, prostatic hypertrophy, the blood clots, chronic obstructions that causes hydroprosis, initiations of continuous bladder irrigations.